So it was talking about the incentives. So to me, let me say four things came to mind. So the first one was sustainability of the goals, system goals that will be set or that have been set. And the second one is continuity of care in light of the goals that have been set or in light of the incentives that have been provided. How can we ensure that the care that patients are receiving will continue should the funding or the incentives stop? Will there be a continuation of care? And the third one is we have to think about incentives and the patient outcomes as a whole. Cross-sectorial discussions of different ministries like education, health, correctional services, and social services. These are all sectors of government that have impact on the personhood or the patient. We are all after patient-centered care, patient outcomes. So we have to think about sustainability, continuity of care, and the overall how financial incentives affect patient outcomes. Other than that, the only other thing that I also gathered from the deliberations was the fact that incentives have to be targeted to a professional group, like a team environment, rather than to a specific professional group. We have to think about a team environment where there are interprofessionals that are working to achieve optimal patient care. Okay, so I'll speak from the context of what my organization does. I'm with the Registered Nurses Association, and I'm the Associate Director for Research and Evaluation. So we look at the implementation of best practice guidelines for nurses, for the nursing profession, and how that affects patients' outcomes. So to me, when I think about financial incentives, I'm thinking about how can the incentives actually help those who are doing the data collection from across the healthcare sector, which we collect. The frontline staff at the hospitals, how they are collecting the information that we need to do the evaluation and the research and evaluation and the monitoring of the indicators, that's the BPG indicators, the best practice guideline indicators. So I see that it will be helpful to channel some of the funding towards the frontline staff. It will be a nice way for them to have the extra support to actually begin to move from paper-based documentation to electronic. We've all heard about e-health, electronic medical records. So it will be a nice transition if they can get that support. The healthcare institutions can get that support to move from the paper-based to electronic medical records, which will facilitate the data gathering and the data submission that the frontline staff have to do to send to the RNAO to evaluate the BPG implementation across the healthcare sector.